Did you know that dietary calcium intake is key to your bone health? And did you also know that vitamin D deficiency is common and supplements are needed? Hi, my name is Wendy Murphy, and this is episode 5 of the Bare Bones podcast. Vitamin D for all, calcium for some, and bones, groans, and stones, where we'll talk about the importance of calcium and vitamin D for bone health. Joining me is my colleague, Anita Kaiser, who has over 25 years experience living with a spinal cord injury. And our guests, Dr. Sarah Morgan, an internist, nutritionist, and emeritus director of the University of Alabama at Birmingham Osteoporosis Prevention and Treatment Clinic, and Dr. Kathy Craven, a senior scientist at the Kite Research Institute and medical director of the Spinal Cord Rehab Program at the University Health Network, and a professor at the University of Toronto. I'd like to welcome you both to the show, Dr. Morgan and Dr. Craven.
Wendy, thank you for having us.
We're excited to be here.
I'll begin with you, Dr. Morgan. Can you talk a bit about vitamin D and its importance for individuals with a spinal cord injury?
Well, vitamin D is a vitamin, but it is also a hormone. And as such, we need vitamin D for good health in a lot of cells in our body. Vitamin D helps us to absorb calcium. And so we need calcium for bone health. So calcium and vitamin D together work to help us with bone health. It is also important to take in adequate amounts of vitamin D for our muscles and our nerves to function well. We also need vitamin D to help with our immune system and prevent infections.
So, Dr. Morgan, what would be an adequate daily dose of vitamin D for someone with a spinal cord injury?
For most people, a total of 1,000 to 2,000 international units of vitamin D per day is a reasonable dose. We don't have a lot of vitamin D in food, so generally most people will need to use vitamin D supplements. And my recommendation is to use vitamin D3, which is cholecalciferol.
Now I'll switch things over to you, Dr. Craven. Now tell me, can this dose vary among individuals with a spinal cord injury?
Of course, Wendy, if there's a group of people in the waiting room, each person would have a customized dose. Vitamin D levels in the body change with medications, stress, fractures, liver or kidney function, and with new medications that are metabolized by the liver. So we want to ensure a customized approach where your blood levels are checked and then an appropriate amount is prescribed to you is the ideal situation to make sure that you're getting enough vitamin D to keep your bones healthy, but not so much that it is a problem.
Thanks for explaining that, Dr. Craven. So, Dr. Morgan, is there a way to get our vitamin D level tested to know if we're getting enough?
Yes, there's definitely a way that you can get a blood level of vitamin D tested. And as Dr. Craven said, this helps us to customize and make sure people are taking in enough vitamin D. The name of the test is a 25-hydroxy vitamin D level, and it is a very common blood test that your physician can order.
Now, Dr. Morgan, is it possible to take too much vitamin D? If so, what problems can develop?
Well, Wendy, vitamin D is a fat-soluble vitamin, so it is possible to have toxicity when you take in too much of a fat-soluble vitamin. However, luckily, our experience and research would suggest that vitamin D toxicity is actually fairly rare. Things that can occur with vitamin D toxicity would be an elevated calcium level in the blood, and it also could cause kidney stones. So this is one of the reasons that you want to work with your physician to customize your vitamin D prescription.
I know calcium is well known for promoting good bone health, but can you tell me, Dr. Morgan, how does it specifically help people with spinal cord injuries?
Calcium is the most abundant mineral in the body, and our bones are the storage. And so for individuals with spinal cord injury, we definitely want them to have very strong bones. So calcium is therefore necessary to build and maintain strong bones. We also need calcium to allow our muscles to move and for the nerves to transmit their messages and for nerves to work. So both of those things would be very important for individuals with spinal cord injury.
Thanks. That's great information, Dr. Morgan. So Dr. Craven, maybe you can share with us, what is the recommended daily dose of calcium for those of us living with a spinal cord injury?
Thanks for the great question, Anita. For most people, so men and premenopausal women under the age of 50, we would recommend a dietary calcium intake of 1,000 milligrams per day. And for postmenopausal women and men over 70, we would like people to have a dietary calcium intake of 1,000 to 1,200 milligrams per day. However, if you are a patient with spinal cord injury and a history of calcium oxalate stones, we would recommend a lower intake at about 750 milligrams per day, with a preference that you get your calcium from dietary sources or food rather than supplements.
That's great for our listeners to hear. Now, I understand individuals with a spinal cord injury may develop kidney stones. How can I ensure that I have the right amount of calcium in my diet?
The most common thing that we do, Wendy, in clinical practice is we use something called the calcium assessment tool to look at how often a patient reports having dietary calcium in their diet. For most people to get 1,000 milligrams a day, they need to have 3 to 4 servings of calcium-rich food per day. And for those with kidney stones, it would be lower at 3 servings a day to try and keep their intake around 750 milligrams per day. It's also important for those with a history of calcium oxalate stones to make sure that not only are they getting the right amount of calcium, but they're also getting an appropriate oxalate intake. Some people, in an attempt to have healthy living, inadvertently have too much oxalate in their diet. High oxalates are found in rhubarb, in sweet potato, beets, raspberry, dark chocolate, and black tea. Instead, people that have a history of stones may want to think about having low-fat yogurt, broccoli, bok choy, cantaloupe, papaya, or water with lemon or lime as a drink, and perhaps to consider green tea over black tea to help reduce their risk of recurrent calcium oxalate stones.
Yeah, kidney stones are not fun. So it's good to understand how they can develop and how to try to avoid them. So Dr. Morgan, we learned about the recommended daily dose of calcium and the importance of getting the right amount, but is there a risk of ingesting too much calcium?
Yes, as Dr. Craven just discussed, I think one of the major concerns would be the risk of kidney stones. So that is why we would tend to somewhat moderate dietary calcium in individuals with kidney stones. And I certainly think that the risk is higher for kidney stones with supplements. And so I would take a really careful look at the total amount an individual was taking in from foods plus supplements in somebody with kidney stones.
So Dr. Morgan, I asked earlier about vitamin D levels, but can I also get my calcium levels tested?
Yes, it's definitely possible to check your blood calcium level. Blood calcium level is regulated quite tightly because of its importance in muscle and nerve function. And we have other things like parathyroid hormone as well as vitamin D that help us to keep this calcium level within a certain tightly regulated range. While you can check a calcium level, checking a calcium level on its own doesn't really tell you much about the strength of the bones or whether somebody has osteoporosis.
I just want to add one comment. I totally agree with Dr. Morgan about her comments about measuring serum calcium levels, with the exception of in adolescence, early after spinal cord injury, where high blood calcium levels can occur and contribute to constipation, changes in heart rhythm, as well as stone formation.
Now, Dr. Morgan, I know protein is another important dietary intake. How does this tie into bone health? And what are the ways to consume enough protein through my diet?
Well, Wendy, I think most people think of their bones just like you think of a skeleton, that it's mainly minerals, but our bones are living tissue and contain proteins. So Protein is part of the structure and helps with the strength of their bones. So protein is very necessary for bone health, and adequate protein intake also relates to calcium metabolism. There are many ways to consume protein through the diet. Things like dairy products and eggs, cheese, yogurt, and meat products are good sources of protein. But it's also important to remember that we get protein through vegetables, grain products, beans and peas, and nuts to some extent.
Thank you, Dr. Morgan. So I know both you and Dr. Craven have shared with us a number of different food items that would be important for us for maintaining our bone health. But if I were to write my grocery list right now, what would be the most important items that I should be including to ensure proper dietary intake for bone health?
Well, Anita, I'm going to answer your question about sources of calcium. I think that we think mainly of dairy products as being good sources of calcium, and they certainly are. But there are other ways that we can also get calcium. For example, things like calcium-treated tofu and canned sardines with salmon with the bones are good ways of getting calcium. Collard greens are a pretty good source. It's important to know that while spinach contains calcium, it's bound up by oxalate. And so particularly in people with kidney stones, we don't want them taking in spinach. There are other things like almonds, broccoli, and dried beans and oranges that are good sources of calcium that you could put on your grocery list. And I would also like to add that there are professionals out there that can help you to translate food into diet. So if you want help with your grocery list and your dietary pattern, I would recommend that you ask to speak with a registered licensed dietitian.
Thanks for this great information. Now, Dr. Morgan, what would be your final take-home message to our listeners?
Check your diet to ensure you eat the right amount of calcium. Check your blood level once a year for vitamin D and follow your doctor's advice related to your vitamin D intake. You will most likely need to take a vitamin D supplement.
Thank you both for this great information. If you found today's talk interesting, check out our action planning tool on the website at www.scifragments.ca. And feel free to send us your feedback using the survey provided on the website. In the next episode, we'll talk about therapies to improve bone health.